Hi, I'm Dr. Hunter, and this is Tammy, and this is our assistant Grendel. And today we're going to discuss how to give liquid medications to a dog. Now, the main goal of giving liquid medications is to make sure that the patient is awake, alert, and aware. And depending upon the health and the age of the animal, we may want to give liquid medications in a small amount. Say, for example, you've got an animal that's a diabetic and might be going through a low blood sugar episode or a hypoglycemic episode. You never want to give anything oral to a patient if they're disoriented and they may not be able to swallow because they can aspirate, meaning that liquid cannot go down into the stomach, it can go down to the lungs, and that can set up a pneumonia that could be fatal. Another example would be giving a puppy some milk replacer. You want to make sure that that puppy is swallowing. As a neonate, they don't have a very good cough reflex. So you could be forcing liquid down their airway and the puppy would never react. And again, you could get a fatal pneumonia. So the biggest goals are to make sure that our patient is swallowing, that we have adequate restraint, and that the patient's head is level or slightly tipped down. We don't want all our liquid medications to go out, but we don't want the head and neck extended because that increases our chances of entering into the airway. So Grendel here is going to be our model. Tammy's going to hold on to him. Typically with the dogs, there's pretty good jowl line here. If you keep their mouths closed, you just need to put a little bit in the corner of the teeth very slowly. And as you can see, he's swallowing. I've even given liquid charcoal, which tastes like paste, to a lab that had an eating issue and needed to have the charcoal given to prevent absorption of the material that he'd gotten into. And he didn't mind at all. And he just sucked down 500 mils of charcoal. So usually this is a pretty easy thing to do in most dogs. Good job, Grendel.